I'm briefly gonna talk you through this case with a 59-year-old woman who had rotator cuff suture performed 7 months ago. She is now referred to me again because she had trauma. She fell on her left shoulder again and is now experiencing more pain and disability from the shoulder, and her treating physiotherapist and herself are now worried that the suture might have re-ruptured. So let's look at this. If we start by, as usually all shoulder protocols start with a short axis view of the long head of the biceps, and if you look at these images, this is the left shoulder is the one that had surgery. Can you see any abnormalities? We see on the right side here nice hyperechoic looking tendon-like tissue. But on the left side, not that obvious. And now, luckily, we have the surgical report, so we know that she also underwent a biceps tenotomy. So the biceps was cut during the surgery, and this is what that looks like through the arthroscope. Here is a flattened and thickened biceps tendon. This is down towards the arm. This is up to the glenoid and labrum. So the surgeon shaves off that biceps tendon, and there it disappears from out of the joint distally down there, and then he cleans up a little bit to get rid of the debris up here towards the insertion point. So that's what the biceps tenotomy looks like. So no biceps within the joint anymore, no flattened, thickened tendon that can cause pain. And about the actual rotator cuff suture, one thing to have in mind when we look at this sonographically is that sometimes the shoulder surgeon cannot pull the tendon all the way laterally to its normal anatomical position. He sometimes ends up just lateral to the cartilage border. Maybe the tendon is too rigid or something, so that we need to be aware of. So if the tendon just gets pulled to the cartilage border, you will get a bare area lateral to that, which can look like a re-rupture, in contrast to if you get the tendon all the way out to its original insertion. Yeah, and here we look at the supraspinatus tendon in long axis, and luckily in this case the sutured tendon was intact. We're looking here at the placement for the anchor, and we can clearly see the suture in long axis view within real healthy, nice looking supraspinatus tendon tissue. And if we compare this to the other side, we can see that this is a nice height of the tendon, nice volume. We can see a little bit of fluid in the overlying bursa. Either this is still a little bit left from the surgery. It can look like that even when 7 months has passed, but in this case maybe it can be also due to the trauma 2 weeks ago. But the tendon looks totally fine. No areas that looks suspicious. And sometimes when we look in long axis, if we look at this area, you can sometimes get a little bit of shadowing underneath the suture. So we of course look also in the short axis view, where we see the sutures as just little hyperechoic dots, and then it's easier to look separately at this area, so we can avoid the shadowing and see that there are no real tears in this area. And you need to look at one area at a time, because in this still image we have a little bit of shadowing even in the short axis view, but if you travel back and forth and look in different angles, you can definitely see and assess that part also. And of course, it's always interesting when you have a patient that has underwent a rotator cuff suture to see, okay, has the supraspinatus muscle regained its strength, and how does the muscle belly look? So here we look at the supraspinatus muscle belly. This area we have the spine of the scapula, the superior glenoid. Here we have the superior humeral head. This little triangular shaped area here is a fat pad, and this is the trapezius. So let's look when the patient does an abduction. We can see that the muscle moves nicely, it has nice fibril pattern and looks quite normal. And we can also compare this to the other side, where we can see that the volume and height of the muscle looks almost identical compared to the unoperated side. And if we look also in the short axis view, we have the clavicle here, we have the spine of the scapula here. We can see a nice looking echogenicity. We can see the tendon within the anterior part of the supraspinatus there and there, so normal looking supraspinatus muscle belly. So in this case we had a happy patient, happy treating physio and happy surgeon, since the rotator cuff suture was still intact. And if you want to know more about sonography following rotator cuff suture or other surgeries, I have put up a short lecture on YouTube. Just search on my name. And if you want to up your skills on shoulder ultrasound, you can also attend one of our courses that we have in Sweden and Denmark this coming fall. So check that out. You can check it out here on the website, all the details. Hope to see you this fall out there in the ultrasound community. Take care for now.